Good day. Okay, today we'll be talking about instrumentations and midwifery, specifically on labor. So I brought out some instruments I could actually show you. They are not just specifically used in labor. Most of them are used in normal surgeries. Most of them are used in normal surgeries, such as the cocas. You could use them to pick some tissue, such as muscle, any tissue that will probably not care if it causes trauma on. We can use the cocas on. So the robots, all these used in holding tissues, all these are actually normal instruments used in the theater during operation. But in labor, there are specific instruments which we use. Now, for the first stage labor room, where I'm assuming we know what this stage entails. So this is the cocas. You can see this two ends, spiky ends, with one going into the other. It's called the cocas. It's actually used for rupturing membrane during labor. That's artificial rupture of membranes during the first stage of labor. And this is a metal catheter. Now, this metal catheter is used when a woman who is in labor has a full bladder and she's unable to pass urine, probably because of the descent of the fetal head. So all we just have to do is insert this through the urethral orifice into the urethra, allow for drainage of urine into the kidney dish, and that is it. Now, this is a metal catheter telling you that it's reusable and autoclavable. It's not like the Foley catheter, which is a one use and you throw it away. Now, this is just for the first stage. We use other instruments, probably if you want to use, like for example, the sponge holding forceps to clean the vulva area with the sponge. This is actually what we call sponge. Maybe to clean the vulva area, just to clean and dispose, clean, dispose. You use the sponge holding forceps too. This is actually what it looks like. Okay, so for the second stage labor room, we all know that once the head, the crowning has occurred and all of that, you pick up your robots. These are robots or large or big artery forceps. This is what they look like. This is actually what they look like. But these are curved. They are not straight. They are curved artery forceps, big. You see them? They are curved. They are not straight. So we use them to clamp the cord. That's the fetal cord. Both the one leading to the mother and the one going towards the baby. You clamp the both of them, and then we use the Mayer scissors. The Mayer scissors to cut in between. That's it for this. And then in case the woman actually has a tight perineum, and you know that if you allow this baby's head to glide through the perineum, and it's going to lacerate the perineum, so what you do is to give a preemptive cut, which is known as episiotomy. You know there are different cuts, but anyway, I'm not going to be talking about that today, but this is what we use to give the episiotomy. So it's called the episiotomy scissors. Now, this is the stitch holding forceps. You see it's different. It's shorter, closer at the end. This is closer to the end. You see, it's used for holding stitches. This is how it is. And then this is our pickup or dissecting forceps. The pickup or the dissecting forceps. So while we stitch with this, we use this to pick up either the stitch, the needle, or even to hold a tissue away while you do your suturing. Now, the cord scissors is not here, but I bet that is why, in case there is clamping, or if you know you have to clamp the umbilical cord and all of that. So I think we've actually alternated that with the Mayer scissors rather than the cord scissors. Okay, so that is it. So you could use a sponge holding forceps in case you want to during the third stage of labor, after labor, and you want to examine the woman, the cervix for tear, you could actually use the Sims speculum. This is a Sims vaginal speculum. Now this is also the Costco vaginal speculum. But you can't use the Costco, which is a self-retaining speculum, because it doesn't give you enough room to actually pass your sponge in it. It doesn't give you enough room to pass your sponge holding forceps through it to actually view the cervix. That is for the Costco. Unlike the Sims, especially if you need the Sims, which is not self-retaining, you could actually hold it. Someone could hold the vaginal tissues away, while the examining midwife or the doctor can actually grab on the cervical tissues, both the anterior, the posterior, and the lateral, and then can view if there's any form of laceration after labor. So I guess this is all for now. If there's any other instrument you probably want us to talk about, you can actually list it in the comments. Thank you.